I lost my daughter Denise to suicide on the 30th of September 2004. We didn't have no warnings. We didn't have any mental health issues with Denise. Denise was 13 years old at the time, and she just left a note saying she felt ugly and wanted to die. Following Denise's death, my son, who was 15 at that time, had mental health problems. He had suffered depression, and he got into a state where we were at our wits' end. We didn't know where to turn. We left the surgery that afternoon with nothing, with no referrals, with no medication, and my son just thought that the world had closed in on him, and he took his first overdose that Monday. To date, he has attempted to take his own life 11 times.
In 2006, a group of people bereaved by suicide joined with mental health service users to try and create change in the health system. They called this the Belfast Mental Health Rights Group. This film is about the process the group went through to create this change and about the lessons we learned along the way.
We use our own knowledge of our own experience, because a lot of us have had experience where we have had family members who have tried to take their own lives and haven't taken their own lives. And we use that knowledge to further the cause of the Belfast Mental Health Rights Group.
The group has campaigned for 4 years for a card before you leave, an appointment system that protects mental health patients who visit accident and emergency departments for treatment.
Anybody who goes to hospital with a suicidal thought, self-harm, maybe took an overdose, who doesn't need hospitalised, will get a fixed appointment in their hand to say that they will be seen by such and such at this date, this time, at this venue, within 24 hours to get a full psychiatric assessment.
So if they had something there, at least they're going to think, I have an appointment, I've got that, and their carers as well, because their carers are going through powerful stress as well. So both those people will have some sort of satisfaction that there is an appointment. Not somebody's going to ring me or send me a letter out. To us, we feel that that's just not satisfactory.
The group uses a human rights-based approach to try and achieve change for people who use mental health services.
What the UN standards and what human rights standards do is place duties on governments to protect rights, and therefore citizens can use those duties to try and hold government to account for their obligations.
It's teaching us how to look at what your human rights are in mental health, how to go about lobbying and trying to get things done, because a lot of people would be, like myself, would be ignorant of what your rights really are.
It's all right us telling our stories and repeating our stories over again. You know, we needed evidence. We needed evidence to back that up. So we got surveys, we went round doors, we had focus groups, and we got people to fill in the survey. So we had evidence to build us up. We also had conferences where we brought in international speakers from like America, England, Ireland, all over.
This model of holding government accountable to human rights mechanisms hasn't been used in other parts of the world.
And I think all of us agree that the way you've presented this is something that is manageable, and you will be able to see the difference that you're making, which I think is incredibly important, because the problems are so enormous. I think it's important to sort of think, well, how are we going to start this process?
The panel of human rights and mental health experts recommended that the health minister implement the Card Before You Leave scheme. We lobbied the Health Committee, which made Card Before You Leave a recommendation in its May 2008 report into suicide and self-harm. Later that year, the minister formally committed to putting Card Before You Leave in place across Northern Ireland. The implementation board was set up to oversee the process.
When the group first got involved in the Card Before You Leave board, it set down indicators for what they thought meaningful participation should be. And this was based on their experience on other boards where they feel like that they weren't properly involved in the decision making. And the Card Before You Leave board incorporated these participation indicators into their terms of reference, and the group was very pleased about that.
Subsequently, the group became concerned that these indicators were not being adhered to, and that their participation was not as meaningful as it should be. It also became clear that there was inconsistency across the trust as to how the card was to be implemented.
Minutes weren't arriving on time, agendas weren't arriving. Sometimes we had to chase up when the dates of a meeting was happening, or maybe meetings were postponed. Just very frustration. Just seemed a sense that and then the trusts were, some of the trusts were starting to have their own definition of what they seen the card before you leave.
We asked for written assurance from the minister that Card Before You Leave was just that, an appointment card given to the patient before they leave hospital. Unfortunately, the written assurance we received was ineffective, and the scheme was rolled out with only 2 of the 5 health trusts implementing the scheme in the agreed format.
They're handing leaflets out with suggested phone numbers if you need help, and a follow-up phone call, which it's proven not to be working.
They say they'll give you a follow-up call, but I lost my niece 4 months ago, and that's a lot of nonsense. They don't do a follow-up call.
The group held a protest outside the implementation board meeting in late 2010 to insist that the ministerial commitment was properly adhered to.
There's still a lot of anger amongst families who have been affected directly by suicide or people presenting with suicidal tendencies, that they're not getting the follow-up care that they should be getting. And today's about, outlining that and putting the first steps in place to ensure that in future people do get the adequate support and help that is their human right at the end of the day.
As a group, of course, we've already set the details of Card Before You Leave and what that means, and the minister, the health minister, has already passed that, and which I pointed out to Seamus Logan that if the minister had already passed that, then why was they doing something different?
And if the ministers aren't going to sit up and take note of what we're telling them, then we'll just have to keep on fighting until they do.
That's it. Stand up and count it, and that's what we need to do.
Yeah.
The journey has been long, and this film highlights the progress that we've made. Most importantly, this is what we know about change.